Thank you, madam. Now I request Dr. Komla HK, Principal, BGS Institute of Nursing Sciences, Bangalore, to kindly occupy the chair and proceed further lecture session. Thank you, madam. I request you to kindly invite Dr. Uma Rani for her deliberation.
Good afternoon to one and all. In today's rapidly evolving healthcare technological and research and technology advancement are growing very fast. Yet, the real problems where we face is the not in generating the knowledge, but in bridging that knowledge to the bedside is very important. So as a nurses, we often encounter with many of the barriers where to integrate the research findings and technologies into practice.
It won't fall.
To give us a thought-provoking session, today we have honored to have with us Dr. Uma Rani J, Dean, Principal, D.Y. Patil College of Nursing, Kolhapur. Dr. Uma Devi is a distinguished nursing academician and the administrator, having 20 years of experience in nursing education, research and clinical leadership. She had made significant contributions to academic governance, curriculum development and faculty capacity building programs, and also had led numerous research projects on enhancing patients' care quality, caregiver support and community health outcomes. Madam has publications in reputed national and international journals, presentations at academic forums and authorship of educational resources. Madam has received awards for her excellence, leadership and service to the profession. So Madam, we are honored to have you on this session. The platform is open for you, ma'am.
Thank you, ma'am, for the elaborate introduction. Good evening, all of you. So today we are going to see about the overcoming barriers to translating research and technology into nursing. So today's objectives will be elaborating on the common barriers which is hindering the research and technology adoption, and analyzing the organizational, professional and cultural factors which is influencing the uptake, and also I am going to deal about what are the strategies to overcome these barriers. We know the translation of research into nursing practice is very much essential. Why it is essential? Because research and technology enhances the nursing practice. Even though it is enhancing the nursing practice, some of the hindrances are there which is really limiting the integration of research and technology into practice. Hence, we must understand what are all the barriers and we should learn how to overcome all these barriers. So why always we talk about translation? Why the translation is very much essential into the nursing? Because we are all living in the rapid era of technological advancement. We know the nursing stands for its forefront of patient care, that is quality patient care, and we are going into the acquiring of new knowledge, and also we need to implement the research and technology into practice. Hence, the translation is very much important. So how to enhance this translation? What is the need for it? It enhances the patient outcome. How it is enhancing? Whenever any institution which is implementing any intervention to its organization, always when it is backed up with some research evidence, it will give a very fruitful result. Similarly, which increases the efficiency. So how the efficiencies are increasing? Once the nurses are able to implement the research evidence into the practice, which reduces the errors in the care, and also many of the time the nurses are having more free time, they will be able to incorporate and communicate with the directly patient to improve the quality. And also it enhances the professional growth of themselves. Whenever they go for innovations, somehow they will be able to have the continuing nursing education where they will be able to update their knowledge and skills. So these are all the key barriers which is existing and which hampers the implementation of the research into practice. So there is a significant gap existing between the knowledge and its application into the practice. Multiple factors are hindering the practice. Why? Because many of the time the organization culture which will not be allowing you to implement, and some of the resource constraints are there in the institution which may also hinder, and over to that the lack of knowledge and skills among the nursing fraternity matters a lot. Coming to the organization culture and resistant to change. In our day-to-day life, whenever we are going to have any change, ultimately our mind will not be accepting for a change. For example, today we are planning to go for a movie as a weekend. So suddenly if any work comes with the spouse or with the children's regular routine, if anything is going to get changed, our mind will not accept. Similarly, whatever is the change, we are going to have it. This is a natural mindset of the people. We will not accept for a change very immediately. Even though the individual and resource limitations are there, because as individuals, they will not have the mindset to adopt the change, and also certain resource limitation. Resource may not be available for us to implement. In spite of that, the culture of the organization, what is existing in the present, we don't want to change because we are all in the comfort zone. We don't want to come out of the comfort zone, so our mind will not accept for a change. So lack of buy-in. Always, most of the time, the leaders are very much resistant to have a change because there is a false assumption. They may be thinking these changes, the technological adaptation into practice may increase the workload. This is what they don't want to have a change. And also siloed departments. In terms of the departments, who is isolated or separated, not at all collaborating with any of the other departments. There is no interdisciplinary collaboration happening in the hospitals or any educational institution or any research institution with the IT department, research or clinical departments. That will hamper the integration into practice. And similarly, inadequate support system from the organization in terms of acquiring the resources and facilitating for the training, that also will be the hindrance for the implementation. The next is the resource and infrastructure constraints. Sometimes our young budding nurses may be techno-savvy and they wanted to have so much interest to implement the research into practice and also the technology information into practice. But even though they are very much enthusiastic, sometimes it will be hampered by the practical constraints, especially when the adequate resources are not available, the institution is not supporting with adequate resources and infrastructure, they will not be able to make it. And similarly, what are all the examples of those resources? Financial constraints, because most of the newer equipments are having high cost equipments. So probably the leaders may not be supporting to acquire those, and also shortage of staff. So the nurse-patient ratio in majority of the hospitals are not properly maintained, and having a very little time, the nurses are not able to spend time for learning for the new protocols and integrating the knowledge and research and technology into practice. And most of the time, the outdated infrastructure. You all very well aware, we are all every now and then we are updating our gadgets, like say from mobile phone, laptop, or whatever is the any technological instruments, equipments we use to update in our day-to-day life. Similarly, the organization, when they have the existing old IT system, that will not be supporting for the innovative areas. And the next is the limited research awareness. Most of the time, the nurses are busy with their workload and they are not aware about the latest research findings or technological advancement. So without knowing this, they are not able to implement into the practice. And also the insufficient trainings are provided by the institution. Every time all the institutions are not giving adequate training for the nurses to enhance their newer technology. Even with the trainings, adequate trainings are given also, sometimes the nurses may not be having the full confidence to carry out the research findings into the practice. So the evidence-based practice is not happening due to the lack of confidence. So the next area is workload and time limitation. As we all know, most of the institutions are not maintaining the adequate manpower related to patient care. So the nurses are not having interest to spend time for understanding the research. Unless they understand the research, they are not able to implement it. And due to the patient load, the workload is increased, and which also reduces the time for them to go for review of literatures. And due to the administrative task, they are not able to develop their professional standards. And most of the time, the shortage of staff nurses, at last it will end up with the burnout, and also it limits the innovation efforts. Then they are not able to adopt the technology. Why they are not able to adopt the technology? Because they are not having adequate information. The limited digital literacy is there among the nursing fraternity. So it is our duty to make use of all the literature support and increase the digital awareness. And resistant to new electronic system. In the latest HIMS and how to maintain the hospital information, patient information data, they should be given adequate training. And they will assume that may increase the workload of the nurses, so they are not able to show interest. Always they used to resist for the newer technology system. Then over to that, financial constraints for updating the technology. So these are all the key barriers to translate the knowledge and research into practice. Why these barriers should be overcome? Because once we overcome these barriers, we will be having a fruitful, healthier patients, efficient workflow, and more empowered nursing workforce. Unless the barriers are not understandable and not taken any step to overcome these barriers, it will result in poor quality care. So some of the strategies to overcome the barriers. So we need to promote the research culture in the nursing profession, because this research culture will give a deep insight in terms of preventing the disease and promoting the treatment. And we know during the recent technological development, some of the tools which is very much supporting for the translation of technology into practice. So these tools are very much useful in monitoring as well as the procedural accuracy. And what are all the role of our nurse leaders? So as nurse leaders, all should be empowering the nursing practice by promoting the evidence-based culture in the hospitals. So usually in the day-to-day life, when they are going and meeting the people, they have to ask some questions and they should know how this can be implemented, the evidence-based practice, and what are all the behaviors related to EBP practice to be well aware for the leaders, and they have to implement into the unit. And capacity building is another area where they will be able to provide adequate continuing nursing education, where it can be promoted to the staffs, and which will improve the competency of the staff nurses and develop the competent nurse in the unit. And every time the nurse leader should see whether there are access for the resources for the unit nurses, and also they will be given adequate training to know about the current evidence. And remove all the barriers which is hindering the translation into practice in terms of any policies, guidelines which is not very clear, that need to be taken care, and it has to be removed. And sustain the momentum. Why? Because we have to integrate the evidence-based practice so that we will be able to get the adequate quality care. And how to integrate the research and technology. Wherever the institutions which are all integrating the research and technology, they have a very good evidence of improvement in their patient care, and also it shows the nurses are experiencing the high job satisfaction where the technological integration is happening. And some of the areas, example, telehealth integration. The institutions where the telehealth platform is there, through that they are improving the access to the patient care even in the remote setting. And also some of the AI-powered diagnostic tools which enhances the early detection of the condition and which quickens the treatment process so that the patient will be saved and secured. And the other one is evidence-based protocol. As per the EBP practice, some of the protocols like infection control policies and also biomedical waste management, all are already existing into practice. So some of the newer evidence-based protocols should be implemented through integrating the research and technology. And the next is the improvement of digital competencies among the nurses. So we all know when we are introducing the AI into healthcare setting, most of the time the appropriate information are not reached to all the nursing professions. So we need to give adequate digital literacy to the nursing profession. It should be given with the training how to search the database and how to evaluate the research studies and how to access the evidence-based protocols and practice. And even the information about the clinical technology, especially the HIMS of the hospital, as well as some of the telehealth care platforms and some of the equipments, how to use the smart pumps and etc. And data management, it is very important to improve the competency to how to handle the patient's data. Every nurse should know how to handle the data with the privacy, and they should know how to secure the patient data and when they communicate, and how to analyze the patient data, because the patient data, the confidentiality should be maintained. And even whenever they are going for digital communication, they must be given a proper training for how to secure the messages, especially with the virtual teams, and also patient engagement tools, how to use those tools during the digital communication. Interdisciplinary collaborations, some of the strategies for the nurses for interdisciplinary collaboration. Whenever there is an opportunity, the nurses should come up and speak up. The clinical observations and evidence-based practice, when they conduct their daily rounds and when they conduct some of the meetings, they should have developed the confidence, and they have to give up the clarity and take appropriate decisions. And they must have the professional relationship maintaining power. So they should identify across the department, they must have the working relationship, so that they will be able to collaborate with some of the research study, or if they want to conduct any research related or EBP practice related workshop and conferences. So the building relationship, interdisciplinary relationship is very much essential to remove those barriers. And whatever it is, every nursing profession should have the updated knowledge to implement all this technology and research into the practice. Regularly, they should be given access for the reviewing of journals, and they should be given training for attending some of the continuing nursing education program, so that they are able to maintain their knowledge updated and be a change event. So champion of change, the nurse should act as a champion of change, because the lead or participate in the quality improvement, it will have initiativeness to require across the cross-cultural collaboration. Wherever the collaboration is happening, there the quality of patient care is improved. So research studies shows the collaboration impact, where there is evidence 47% of the departments where they have collaborated, they have a reduction in the patient's readmission, as well as where the collaborative departments have quickly adopted the EBP when compared to the departments which is not collaborated with the other department. Similarly, 62% of the nurses, they had high level of job satisfaction when they worked and started the EBP, whereas when compared to the other departments where there is no collaboration happening. And at the same time, 28% of the interdisciplinary collaboration have a highly significant improvement in the patient safety. So ultimately, the collaboration is very much essential to implement the translation. Promote the robust training, because once the technology is coming into practice, rigorous training is required for the nurses. The hands-on training, especially through the simulation center or any other online modules, the training can be given to equip them with the adequate knowledge and skills. And invest the infrastructure and the resources, because the infrastructure and resources plays a major role. Unless this is invested, we are not able to succeed. So more budget should be allocated for the infrastructure and the resources, so that it will facilitate the integration of knowledge, technology and practice, and foster a culture of innovation. So culture of innovation should be implemented within the nursing area, because promoting research culture always value with the continuous learning. So unless the nurses are given a chance for continuous knowledge enhancement and to involve in the innovations, implementation will be a big question mark. And at last, monitoring and evaluation. So monitoring and evaluation also plays a major role. Whatever we want to implement, if we are implementing just like that, we are not monitoring what is the changes happening, what is the output of the change, so it is of no use. So regular monitoring and evaluation is very much essential so that we will be able to measure how the objectives are achieved or not. So this can be achieved through the clinical audits. So clinical audits regularly should be conducted to assess the adherence to the EBB, and also outcome tracking. So we should know how much the intervention is given and what is the outcome of the particular intervention. So longitudinal monitoring of the patient outcome to evaluate what is the impact of that evidence-based intervention in the particular unit. So outcome tracking is the must area. And at last, the feedback from the staff. Even though we are implementing certain things and there may be challenges, so unless we get the feedback from the stakeholders, we will not be able to analyze what are all the changes which is undergone by all the stakeholders to implement. So feedback is very much essential. So regular survey can be conducted among the stakeholders to get the feedback. And some of the area of monitoring and evaluation, what as nurse they have to see. In case of monitoring, we need to know, are we doing what we planned? And also, are the resources are being effectively used or not? Because sometimes we will be getting the new equipments and newer protocols, everything it is in place, but it is not properly utilized. So regular monitoring is necessary to know whether the particular resource is being used effectively and what are all the adjustments are needed for proper implementation. At the same time, at the end when we evaluate, periodic assessment of the outcome need to be evaluated. So whether we achieved the objectives or not. So what went good and what went wrong need to be assessed. And what are all the things changed as a result of our integration, and was this integration is effective or not. So these are all the areas we need to evaluate to measure the outcome. So both evaluation and monitoring work together to bridge the gap between the knowledge research and integration into the practice. So to conclude, overcoming these barriers can improve the patient outcome, and also it will enhance the professional and decision making. It strengthens the quality and safety of nursing care. I'm sure by fostering the continuous learning, encouraging the EBP and supporting the adoption of digital innovations, nursing can provide a high quality patient care in today's evolving healthier environment. So the take home message is, from evidence to impact, together we can advance, translate research, elevate the practice, and improve the lives of the patient. Thank you. Any questions?
Thank you, ma'am. Now the platform is open for the discussion. Any questions from the delegates? Please, you can put forward. If there are no questions, thank you, ma'am, for the wonderful session. And your session today, it has closely highlighted that it's a challenge as well as it's our responsibility. By addressing these barriers, nurses can empower and nurses can deliver a safer, smarter and better care to the patient. I thank DSU for the opportunity, and also I thank Madam for the wonderful session. Thank you, ma'am.
Thank you, madam, for such informative scientific session. I kindly request Dr. Pushpa Sarkar, madam, to hand over the memento and certificate of appreciation to Dr. Umarani, madam. हाँ, no issue. Thank you, madam. I also request madam to hand over memento and certificate to Dr. Komla.